Okay, so this is the Anatomage Table. It is 3D, interactive, and very easy to use. It's all hands-on touchscreen. Everything that you're seeing today is taken from the real human cadaver. So these are real bodies, and everything that can be touched and removed simply by the tools and features of the table. So you can see every human body system in here. It's very customizable in terms of showing all the body structures. Just like in a smartphone or an iPad, you can pinch to zoom. And you can remove structures layer by layer to understand the spatial relationships. So there's lots of tools and features like the blood flow tool, where if I pick on a structure, I can see the direction of blood flow, and I can also understand which features those are in terms of the vein or the artery. And you can see that it goes all the way to the heart. Just like that, I can bring back the full body. This is also in one-to-one life-size position, so I can understand the size of the human body as well. So this acts as a support system for a cadaver lab, or to mimic a cadaver lab, being that it's a real cadaver. So we have a virtual dissection tool where I can virtually dissect the human body and see all the anatomical features. So I can pick and choose what I want to dissect. The touch of a finger, I can bring it right back. This also has different features like the quiz or game mode, where I can teach myself the human body systems through self-quizzing. So everything that I touch, it will turn on the label and tell me what those structures are. I can also add different body systems as I go along. So from here I can turn on the rib cage, for example. If I wanted to add some muscles, I can turn on muscles of the head and neck. Thorax. Abdomen. So I can also use the split screen to see different slicing of the body. So if we remove the structures this way, for example, I can also see the liver, and I can see the liver down here as well. So we can do a sagittal slice, we can do a corneal slice. just like it is here. And everything I touch will label itself. We also have the case library. The case library has over 2,000 pathological studies or cases where you can see different types of pathology. This is an example of a gunshot wound to the head. You can see the opening wound here. Here's the opening wound, which also corresponds down here as well. You can see where the bullet is in the CT scan. So what this image is a CT scan of a bullet inside the head. It's penetrating the brain here, and it's lodged in the skull. So what I can do is I can take my scalpel and open up the skull this way and look for that bullet. Here's my opening wound. I can see the bullet through here. And if I zoom in, I can see how it's lodged in the skull. And there's my bullet there. So let's take a look at another CT scan. This is the 2-year-old conjoined twins. So this is obviously pre-op. You can see different filters like soft tissue and hard tissue. The CT scan is down here and will correspond with the image up here. So I can remove the soft tissue as well to go to the hard tissue. You can see where these 2-year-old twins are conjoined at the sternum. They're also sharing some abdominal structures here. And what I can do with my scalpel is just take the blue scalpel and run a line down the middle and simply perform a dissection. So I can see where they are conjoined. Rotate that as well. Okay. So we also have some features like physiology. This is the main menu. You have the gross anatomy. There's 2 male and 2 female cadavers. And then you have the cadavers in high-res regional sections like head and neck, brain, organs, and different structures of the body like the extremities. And then we have our case library. So there's over 2,000 pathologies in here. And we also have 4 animal cadavers, 2 dog, cat, frog, and mouse, and hundreds of animal scans as well. Okay, so this is the high-res regional heart in the physiology format, where you can actually see the heart beating and these valves opening and closing in real time. So here we can change the EKG to increase or decrease the heart rhythm. What you're seeing in yellow are the actual nerves firing. You can see the SA and AV node. And there's the tricuspid valve opening and closing. And we can talk about rhythms like PQRST and also increase or decrease the heart rate from tachy to brady, about 40 to 150 beats per minute. So I'm just going to take my blue scalpel and run a line down the middle here. And just like that, I can perform a virtual dissection of the dog. You can remove structures there and there as well. Okay, so that's the dog. This can be used in lots of different ways of teaching for students and for teachers. For teachers, they can design lecture to match their curriculum to teach throughout the course of a semester or a school year. And they can design it, and we can also help design them as well. And then from here, you can do things like take quizzes, use our game mode feature, and to help the students have a hands-on learning tool. So, for example, what we can do is perform a quiz on here. Flashcards. There's different types of settings of quizzes, like multiple choice. For this one, we do flashcards. So with the flashcards mode, it will tell me if I get something right or wrong. So it's asking me where the left scapula is. And so I'm going to rotate the body, and in the sense of the orientation, obviously this is the left scapula. And then I'm going to hit confirm. It tells me if I get it wrong or right, and can go to the next question. So the right acromion, this is going to be on the right side of the body. I'm going to select a structure here. If I get it incorrect, it'll say it's incorrect and show me where the right answer is there. Okay, so I can exit this quiz and the teachers can have access to the score of my test, and I can export those results in a PDF format. So I can do that with any human body system to learn all the human body systems and understand how they work. And I can go through and cut through every body structure that I see here. So I'm just going to select one of these arteries so I can see the blood flow. And you can see how the blood is moving towards or away from the heart. one of the areas of the body in the brain is a really great example to understand how this imaging in the Anatomage Table is really superior in terms of a learning tool and imaging device. So let's take a look at that. We can come in here and look at the head and neck. What I'm going to do is remove structures layer by layer. One structure at a time. So what we're going to do is we're going to get to the brain. I'm going to remove the skin here. And just layer by layer, I'm going to peel back all of the structures to see about getting to the brain. So every time I touch a structure, it'll actually label itself. So this way I know what the structure is. As you see, the muscles start to remove themselves. We can actually get into the details of the brain. So just by tapping, I can remove structures layer by layer. Really analyze the brain there. Here's my corpus callosum, internal capsules. Also take off the teeth here. And anything that you do, you can also undo. And what I can do here is open up my knee. And what we'll do, we'll take a look at the knee this way as well. We'll just cut a big square around the knee. And once the knee opens up, I'm going to transfer this image to one side of the table, and we'll have the artificial knee to the other side. So I can look at the differences between a real or an artificial knee. So as you can see, there's a lot of different features to use this table, but a very beneficial tool for teachers to perform lectures and also create practicals for students. Everything's hands-on and touchscreen, so it's a very great tool for kinetic learners to really understand the human body, no matter what body structure there is. Again, this is authentic real cadavers. Everything's taken from the real human body. At the time of death, the cadavers were frozen, sliced, and imaged. All these bodies were donated to science, and we were able to obtain those bodies to put into our imaging to provide this wonderful hands-on learning tool.